Hello, everyone. This is Mark Anthony with AIEdgePodcast.com, the place where we bring you the best of the best doctors, physicians, even awesome registered nurses. As we know, they do most of the work. I'll just throw that for fun. And so today we're going to be talking on a subject that a lot of people don't know about, but they need to hear about it. It's called EECP, the most underutilized therapy in medicine. Thank you so much, Michele, for being here.
Thank you.
Yeah, so tell us, what is EECP? I feel like I'm in a Star Wars movie. Talk to me.
It is indeed the most underutilized therapy in medicine. It stands for Enhanced External Counterpulsation Program or therapy. And what it is a bed, a huge bed, 500-pound bed that you put the client in, and then you secure their calves, thighs, and hips with pneumatic cuffs that are like blood pressure cuffs.
Okay.
You put the patient on a cardiac monitor that monitors their systole and diastole. That's the contraction and the relaxation of the heart. And it is that contraction and relaxation that blows up, inflates, and deflates the pumps that are around your legs and hips. That's the counterpulsation. And so when your heart relaxes, the blood pressure cuffs pump up and they propel hyperoxygenated blood through the torso, the body, the heart, the lungs, all the way to the brain. And in so doing, it creates collateral circulation. It's arteriogenic, new vessels, new arteries. It reduces blood pressure. It increases nitric oxide by 60%. It reduces the stiffness of the vascular system that develops as we age. So it gives you back elasticity in your vessels and your arteries, thereby reducing blood pressure. The number one use is for cardiovascular disease because it can recreate collateral circulation around your heart. And think of it as your arteries are expressways. If they get stenosed or small, we're creating highways and byways so that the blood can flow regardless of a stenosed artery. So if you're someone that has cardiovascular disease and maybe shortness of breath and fatigue and maybe chest pain, we're regrowing circulation so that we have blood flow and it alleviates the chest pain, the shortness of breath, the fatigue. There are incredible side benefits as you do the heart restoration. You're also restoring lungs, kidneys, pancreas. You're just getting, blood is the healer of all things, is what I said.
Right.
And so if you're creating new highways and byways, new perfusion for the brain, the retina, the pelvic floor, it addresses ED. It addresses the men who have to go to the bathroom 5 times a night. They go down to 1 time a night because it increases the bladder flow and allows them to be able to hold that. That urgency goes away. So it's pelvic floor reconditioning as a side benefit while you're regenerating your heart. Amazing technology that no one knows anything, very few know anything about.
Okay, you said something about the retina, the eye.
That's right.
So could this help with people that have maybe, say, severe glaucoma, that
if the problem is low blood flow in the retina, it will improve their vision. If that's the cause of their visual problem is low blood flow in the retina, and so many people have that as we age, the flow starts slowing. Cognitive, the dementia, Alzheimer's, those can be low flow problems in the cerebellum. So if we increase the flow, we improve the functionality of the cognitive.
Wow. So what you're saying, please correct me if I'm wrong, what I hear you saying is that where there's inflammation, and let's say that inflammation is puffed up, we'll just use that term, puffed up, so that when it's puffed up, it creates inflammation, which the blood flow is not able to get through. So when you utilize this machine, it helps with the blood flow and deflames the inflammation.
That's right. It's an anti-inflammatory process at a biochemical level. You are correct.
Wow. Okay. So what are some of the things now? Have you been using this? Have you started this? Is it just something that's fresh and brand new? How long it's been out? Stuff like that.
Great question. So this machine was developed at Harvard University back in 1960. It became popular in the 70s, but also at that time, open heart surgery became popular, stents became popular, and those things are covered by insurance. The
Oh,
EECP bed regenerates you from within. Your own body heals itself, but it is not covered by insurance in most cases. The only time Medicare covers it is if you have class 4 angina or chest pain after you've had all these, the cabbage, the open heart surgery, the stents, and you've failed all those things. Only then will Medicare cover. And so
wow.
people just use it as a last resort. It actually just got, because of the way our healthcare system rewards for procedures, they reward payment for procedures. They don't
Right.
reward for this preventative or regenerative. And so it was just underutilized. However, it was FDA cleared in 1995. So
Wow.
it can be utilized, but it's just been sort of on the back burner. But with all the regenerative medicine coming out and all the clients I've been getting that want regenerative medicine, that want longevity, that want wellness, I see the need for it. I didn't even know it existed, Mark, until about 6, 7 months ago. And a client came
Wow.
to me and I'm giving him this plaque X treatment, which eliminates the plaque in his body. It's an IV you
Right.
take twice a week for 10 weeks minimally. And he said, "Where is EECP in Tennessee? We can't find a unit." And I had it in Washington State. It saved my life
Wow.
back in 2020. And I said, "Well, what is EECP? I don't even know." So I began to research it, and I found that Texas and Florida have several EECP clinics, but there aren't any in the South, very, very few. And so I thought this is an underserved market. This is an incredible technology. I went to school on it, studied it, read the book by Dr. Deborah Braverman, which I could recommend to everyone.
Mm.
And I just knew my whole goal is to reduce the pain and suffering of humanity. That's always been my calling on my life as a nurse. Do whatever you can to reduce the pain and suffering. And this is a huge win. And so I've bought a bed. It will be delivered the week of the 15th. I've already
Wow.
got my schedule starting to fill up as I just talk to people passionately about the healing that it brings and the side benefits. Heart disease is the #1 killer in the United States. So what if we were proactive to people from their 40s to their 60s before they develop heart disease?
Preventive care.
Yes, that is my goal.
Yeah. I
That
love it. Wow. So this machine, it'll be coming soon, which is really cool. And you're already getting booked up. It's called, so is that what they just call it, the EECP? There's no other like, would there be like, I'm just trying to like, like stem cells. We say stem cells.
right?
And then we knew that it started to work. And so then we had to change it to mesenchymal cells.
Yes.
Are there any other, is there a way that you're going to be maybe branding this out there so that people don't look at it like, oh, it's some Star Wars name or something, like, does that make
Exactly.
sense? Like, have you been working on that or any ideas?
I've got some ideas. I haven't codified anything yet, but flow
Mhm.
therapy is used a lot in Texas. I don't
Flow.
think that it's trademarked. Flow therapy makes sense if you call it blood flow therapy. I haven't landed on a name. I do like Forever Young, the Rod Stewart song,
Oh, yeah, yeah, that's a great song.
because everybody in this generation that we're dealing with knows the song, and everybody wants to be forever young. That's why they're coming to the
I
longevity.
like that. You know what? I'll tell you what would catch my eye. We're just going for it. We're going to have fun here. So I'll tell you what would catch my eye. I'm just thinking, you know, you know, the Forever Young machine. Something where it's like, what do you mean Forever Young machine? It's kind of hooky a little bit. And,
Or forever
I,
therapy. What about forever young therapy? What about that?
yeah, therapy. Yeah, but
Machine or therapy?
yeah, therapy's used a lot, but I'm like thinking, okay, because we want to get people to understand that this is bringing healing, you know, uh, and that's something we could talk about later. But I'm getting all into it now with you. We're ping ponging now. But so tell me a little bit more about this machine. So it came out around the 60s and then it got trademarked in 95, correct? Or not trademarked, but
FDA cleared.
that's huge. So that
Cleared.
means we know that it works.
That's
It's
correct.
just people haven't really been pushing this machine. This is the first time I've ever heard of it, and I've been podcasting since 2008. So,
And I've
uh,
been a nurse 35 years. I learned about it 6 months ago. I am
wow.
sold on it. I'm on board. I've talked to people who've used it. It's changed their life.
Tell us some stories that you've heard from other people that have utilized this and it just did a 360 in their life.
Yes. And so the man, and he doesn't mind me using his name, he's from Prague, he and his wife, Jan and Yitka. Jan is an aerospace engineer, lived in Washington State in 2020, had a massive heart attack, refused to go to the hospital because that was during COVID, and they wouldn't let his wife go. And he didn't want to be without her. And he was a cardiac invalid. He couldn't walk 6 feet without chest pain. And then he found the EECP technology, the machine. He did 35 sessions, Mark, and after 35 days of 1 hour sessions, he could walk a mile, 6 feet before therapy, a mile after 35 treatments with no chest pain. He repeated
Wow.
it again in 2023, and he can now walk 5 miles a day with no chest pain. And he didn't have the stents, the angioplasty, the open heart surgery. And now he does Plaque-X, which is an IV infusion to melt plaque so that he doesn't have to be on statins. If your patient's
Wow.
going to get off of statins, you put him on Plaque-X. And then this machine augments the rebuilding of the heart. So he's using the best of the best in regenerative medicine. And my clients teach me so much. They fly to me from all over the country. And so they have just vast stores of knowledge and information that they share with me that I research. And this is one of the most exciting things that I have encountered in my nursing career based on the testimonies I hear. Dr. Deborah Braverman's book, Heal Your Heart Non-Invasively, talks all about it. It's an easy read for a layperson, but it's also got all the science behind it. You see, China and India use it proficiently because their healthcare system rewards on outcomes, not on procedures. Rewards physicians to do procedures. So they become proceduralists. And there's a time and place for all these things, but China and India use it tremendously. So there are a lot of studies, double-blind, randomized controlled studies out there that give testimony to this.
Why do you think this is not being pushed? Like, I mean, it just doesn't, it kind of bothers me a little bit because I feel like when we have things that are really helping, we don't hear much about it. And then we hear a little bit about it. Kind of remember when Mel Gibson let's be honest, Mel Gibson blew up stem cells because of his father when he was on the Joe Rogan show. He was about to die and he had to go to another country to get a stem cell for his father. His father lived till I think he was like 83 at the time. Then he lived till about 98 or something.
Yes.
I mean, this is, and it changed his entire life. It's weird how we will promote commercials for stuff for diabetes, and then at the end of the last 60 seconds of that commercial, you hear real fast, could cause diarrhea. Your brain may fall out of your head. I'm just joking. I can say that because I'm not a doctor, so I love it. You could say, they say all this bad stuff that can happen to you. And the sad part about it is most of the people that I know that take this stuff, it does happen to them.
Yeah.
So it just doesn't make sense. What are your thoughts on that? Why do you think it sounds like it's being covered though?
It's system driven. Our healthcare system in the United States is driven by procedures. And so Western medicine is all about procedures. And an open heart is a wonderful thing if you need it, and stents are wonderful if you need it. But the reality is, Mark, if you get a stent, you're going to get another one in a few years. You've got a blood flow problem in your heart, and then you'll get a third, and then you'll get a fourth, and then that stent will occlude or stenose, and then they can't do anything for you. And so I tell the cardiologist, send me those people. I'm not trying to take your business. I want to help people who no one else can help. But to be honest, to be proactive, you wouldn't go down that path of needing all these percutaneous coronary interventions.
Wow, this is really good. So unbelievable. I can't wait to see this machine.
Yeah, come and see me for sure.
Hey, I want to go see Dolly World. I've never been there. My grandfather bragged about it because he was a big Dolly fan back in the day. I mean,
we're all Dolly fans out here in Tennessee. Yes, she's our queen.
Have you met her before, or have you seen her?
I've seen her here and there, but I've not met her. I do have a room in my clinic that's my Dolly room, and people have brought me books and albums and various things of hers. And it's funny, we set our aesthetic room up to be the Dolly room because you can look at Dolly and say, do you want these eyebrows? Do you want these lips? Do you want these cheeks? Well, how do you want it to look?
Or is there anything else you want?
And
Love it.
I can't do anything from the neck down.
Oh, that was a good one. Oh, Lord. Okay. No, dun, dun, dun. Awesome. So you'll be getting this machine real soon. And then the cool thing is we'll have to have you back on because I want to hear
Yes.
about these testimonials. I mean, it would be even, I'm just throwing stuff, I'm just throwing a football for fun right now. It would be fun because I'm sure, see, you have a very vibrance about you. So you probably have a lot of people in your clinic that are vibrant just because you kind of attach, you attract what you are, I see in this life. But it would be cool if we had you and then had them on here too,
Oh, it would.
because
And
it
we could even have them on the bed. You could,
100%. I mean, dude, I
yeah.
mean, there's so many things. I mean, you and I are already going back and forth on the name. I kind of like the whole forever. You said it was forever young
Forever
therapy.
young. Yeah, forever young
Even
therapy.
therapy sounds good because it makes you think, what is that? What do you mean forever young therapy? Yeah, yeah. So yeah, we'll have to bounce on that because you have a great voice. I love your passion. Your focus is helping people. And a lot of people don't realize being a nurse, what that entails. I feel
Yeah.
like there's not enough accolades because, you're there with the doctor. I mean, people don't realize they're doing the injections. You guys are doing a lot of stuff, you know,
And I'll
and this,
tell you, Mark,
yeah.
there is a cost of caring for nurses and physicians. There is a cost, and it's cardiac. We often develop right-sided heart failure as we age.
Oh, I did not
That's
know.
the cost of carrying, the cost of carrying
Wow.
people's burdens. And
Wow.
that's documented fact. And so I can hardly wait. I don't have any physical problems, knock on wood, but I can hardly wait for the machine to arrive and I begin to rebuild my heart so that I never go into right-sided heart failure. That's going
Wow.
to be preventative for me, a nurse who cares so much about so many. And, that's just the result. The cost of caring is what I call it.
Man, I love it. Tell us a little bit about like kind of like where you're located, where people can find you, and some of the things that you offer in your clinic so that people can know.
Okay, so we're in Brentwood, which is 15 miles south of the Nashville airport. And Nashville is a destination place right now. And so I'm going to put together packages to heal your heart, to come and stay in an Airbnb, use it clearly, get an AI
Oh,
imaging of your heart before and after I treat you and that sort of thing. Putting it all together. We're just off of I-65. It's easy to get to, half a mile off the interstate in Brentwood, Tennessee. That's where we're located. And what do we offer? We offer IVs, of course. I'm a vascular access nurse specialist, so I had to have an IV room. Our IVs consist of everything from wellness IVs to anti-inflammatory things like ozone
mhm.
IVs. We offer a lot of vinifer, which is iron,
Right.
women with pernicious anemia and men. So we do treat that. We offer we also do intravenous stem cells, but we also do intra-articular stem cells if we need them in the knee, the shoulder, the spine. I also have a spinal surgeon who does intrathecal stem cells for me. That's into the spine, directly in the spine. It floods
Uh-huh.
the back of the brain. Then we turn the patient over and we put them in the sinuses, and that will go across the cribriform plate into the front lobe of the brain. We're treating Alzheimer's, Parkinson's, cognitive dementia, TBI with that flooding the brain with stem cells. And that's been incredibly effective for Parkinson's. And I've just done my second Alzheimer case, and we wait 6 months to know where we get. It takes that long to see where we're going to get with them. But I'm really excited to be able to have that surgeon to access. And then I've got a nephrologist that I access. I have every specialty that I need to access because of my years of vascular access and serving various hospitals for 35 years, putting in a device called a PICC line. So I have lots and lots of relationships with every specialty out there. So I do believe in Western medicine very much, but it doesn't have all the answers. And that's why one reason I opened this wellness regenerative longevity clinic is because we can do other things. We can do some Chinese medicine, we can do ozone, we do stem cells. It's a more complete package of healing for people.
Mhm. Looking for because you're focused on the whole body. It's not just we're just a one and done.
Right.
It's
And
right.
multiple modalities, not just Western medicine, multiple modalities.
And how long have you been at this practice here?
Since August of 2021, just after COVID, I sold my other business. I was done with managing 30 nurses going through COVID and 88 contracts of hospitals. And so I sold that and opened this clinic in August of 21.
Wow, that's amazing. So where do you see your clinic going? Like what's your vision for your clinic right
I
now?
want to have 3 EECP beds. I want to have 3 rooms dedicated to healing people's whole body. Do you know, and I'll tell you this, just an aside, 9 out of 10 men who come to my clinic who are over 50, when the door closes, they say, "What do you have for ED?" And what we've had for ED, erectile dysfunction, is pills. And there's shock therapy that many of them have been through, and it didn't help, ultrasound shock. There's P shots, there's O shots, but I'm able to actually restore blood flow to their whole pelvic area with my Forever Young machine and take them back to when they were 20 years old. And I kid you not, this is the testimony of the people who've been on the machine to rebuild their heart. It actually rebuilds that as well. And they are thrilled at 10 to 20 sessions, their sex life comes back and they are happier people, more social people, because
Yeah.
we fixed something they didn't know that could be fixed, and it can. So
Wow, that's amazing. So, man, so you're making a lot of people happy at the same time. So, um,
making them well, functional
well,
people. Yes.
feeling whole again. That's the key.
Yes.
Are you able to work with people that have had, like, say, open heart surgery and stuff like that? How does that work?
Yes, they can have pacemakers and defibrillators. Oh, they can have had stents because many of them have, maybe they've had open heart surgery 5 years ago, but they're back to square one because
Mhm.
nobody solved the root cause. The root cause is low blood flow. So you're going to need another cabbage or open heart surgery. You're going to need another stent. Well, let's regrow it. Let's regrow the vasculature so you don't ever have to have another procedure. And as I told you about Jan, he's going to be doing the EECP every 2 years, the rest of his life. He's 76 years old, in fine shape, wants to stay that way. And there's a new book out. I'll have to get back with you on the name of it. It escapes me at the moment, but Jan brought that book to me. That man who wrote the book has done 600 hours on his own EECP machine. And I don't think the man will ever die. He's got wonderful testimonies in his book of what it has done for him, his wife, his friends. He's basically a private, not private, but just an individual who trained to do EECP because he needed, and this is an interesting testimonial, he needed a triple bypass. He had a occlusion of his arteries. He needed a triple bypass. But 20 years ago, his mom had had a triple bypass and she developed dementia shortly thereafter.
Mhm.
Dementia that's a blood flow problem. And he said, "I'm not going to do it." And he left the hospital against medical advice. And they said, "You won't live. You won't live till tomorrow." They told him that, and he did live. And that's been many, many years ago. And now he's set out to educate the world on EECP as an alternative. Even though you have to pay for it out of pocket, you're buying a new heart. You're buying a new life. You're buying,
You can't put a price on that.
no, no, you
No.
can't.
So when is this exact machine going to be in your office again?
The week of June 15th, they're going to tell
Okay.
me when it's on the way, and then they will send my trainer, and he'll spend the week with us just to, train us in the use of the bed and the cardio rhythms and all these things that we need. But they're critical thinking skills that go with running the bed, and so it's very helpful to be a clinician. Even though this author of this book was not, he was determined he was going to live and not die, and he does. And his wife has lots of autoimmune problems, and it has resolved many of her problems.
How about with people with like say neuropathy and diabetes and stuff like that?
Oh,
Does this
yes,
machine
yes.
help out with that?
Mark, it does because it increases blood flow. Diabetics have the worst veins,
Yeah, they
very
do.
small. Their microvascular is just awful. And so it recreates their whole life, their whole venous system, their circulatory system. And with peripheral neuropathy, depending on the degree of neuropathy, you might need more than the 35 treatments. You might need 50 treatments, but it's going to regrow vessels. And that's how you get your feeling back. And I have a couple of diabetics already signed up for it, and they're like, they're young. One's in their late 40s and one's in his early 50s, type 1, and he's got neuropathy, and he's coming to me for that. And we've got a laser we're treating it with, but this will eclipse every therapy that I have for neuropathy.
Wow, even better than shockwave, huh?
Yes, much better. It doesn't hurt.
Yeah.
It's just
I know, huh?
a rhythmic pulsation. And a lot of people go to sleep. And my office backs up to a green space park where we have deer and fox and everything come to our window. So I'm just going to put the bed facing the green space, and they can just lay on that bed and chill and heal. Chill
Wow.
and heal. There we go.
Chill, chill and heal. Wow. Wow. So this is amazing. I'm just kind of still flabbergasted. I've never heard of it.
As
Uh,
was I, and still am, 6, 7 months later. I still can't believe that I've been in medicine for almost 40 years and never heard of it.
so you said there are people that are utilizing in Texas, and where's the other place? Florida?
Texas has 14 centers that I found in Florida where they have huge populace of elderly, and they've got 15 centers. And that's the closest I could find to Tennessee. And so, I mean, we've got people too that hurt and need and want to heal. So I'm bringing that bed in for them.
Wow, it's so interesting because it's been around for such a long time and it sounds so fresh and new.
Very well said.
Yeah, and it's interesting because I say this a lot with people, and I said it for me, I feel like the old is the new. And sometimes when I say that, I mean by we need to go back to where this came from.
Yeah.
And sometimes we come up with all these new inventive stuff, but really, are we reinventing something that's already been invented and
Yeah,
already
there
works?
is a verse in Ecclesiastes that I believe in. It says there is nothing new under the sun.
Yeah,
There is nothing new under the sun.
such a good book, I tell you. Yeah.
Yeah.
Yes. What does that start off? Vanity of vanities.
Yes.
Wow. So thank you so much, Michelle, for being here. I'm excited to see where this is going, and I can see us doing a part two on this because I already have some ideas how we can get this information out there. Now, everyone out there in the internet, beautiful internet land and social media, if you have people that right now are struggling with major inflammation, brain fog, neuropathy, have going through diabetes at whether you're in your 30s on up or even younger, it seems like things are going, people are getting neuropathy even in their 20s, which is really
Yeah.
sad. People take a look at this website that this beautiful machine, the EECP, will be there within a couple in about another month, probably about
No,
a month and a half.
next week, the
Oh,
15th of
next week,
June.
man. Oh man,
15th of June.
oh
Yeah.
man, I still think I'm in May. Forgive me. Yeah, so yeah, we're in next week. So you can go to carenashville.com. That's carenashville.com. People out there, I always say this, caring is sharing. And the reason
Yeah.
why is because a video can change one person's life. And our goal is to help as many people as we can to get out of inflammation, to get out of pain, and to get into a whole life, a whole body therapy treatment. We live in times, my friends, that we're driven by pills, and the pills just patch. And when that pill no longer works, you need a stronger one and a stronger one. And after a while, there's no more pills. So I encourage people, don't give up.
Yeah.
Look for stuff out there. God gave so much to so many people, and sometimes other people like to cover that because they don't want you to be healed, or they want you to be thinking that you are healed because it becomes about the money. So everyone, take a look at this. And again, Michelle, I want to say thank you so much for being here. But before we leave, what is something that you would like to say to the viewers that are maybe struggling with a lot of these things that the EECP machine can help people with?
I would say to Chat GPT, where is EECP near me?
Okay.
Because it may be there and I don't know that it's there. I know Texas and Florida have several beds, but there may be one or two beds here or there. Certainly want you to come to Nashville, but if you can't, you need healing more than you need to come see me. You need healing. Find it. EECP.
I love it. And thank you so much for being here. I look forward to having you on again.
Thank you, Mark.